This is a very bizarre question, and I really appreciate that the person sent this in, because this is a really, kind of a scary story. He says, after 10 years of active surveillance, my PSA went from 5 to 65 in just a few months. The MRI and the bone scan have confirmed bone metastases, and the biopsy showed Gleason 8. He said 8 and 11. I've never seen 11, but we'll go on. Is it common after 12 years of a steady PSA that this can occur in just 5 months?
No, it's not common, but it certainly can happen. It all depends on, again, the biology and genetics of the disease. I mean, cancer is a genetic disease. And I should be honest and tell you, my wife has a PhD in genetics, so that's where my background comes from. And I went to meetings with her 30 years ago, and they knew then cancer is a genetic disease. It has to start with the gene, and it can be influenced by the environment, all kinds of environmental factors. But yes, it can happen.
Well, that gets me into genetic testing, which I think we ought to talk about a little bit, because a lot of people, when they're diagnosed with prostate cancer, want to know a lot of their genetic tests. People are very well versed understanding that there's more than just the pathology of the cancer, there's the genetics of it. And over the past decade, there's been a significant development of genetic testing, not only of the tumor itself, but now looking at what we call the somatic, or the person themselves, looking at their gene pool and seeing what their risk factors are for disease development and disease progression. So this is really important. And also we now have some tests that look at how men respond to hormone therapy. Are they going to be good responders, or should they go to chemotherapy instead of some of the advanced hormone therapies that we have? So my question to Dr. Powell is what types of available genetic tests do you presently use to manage your patients?
I think I may have mentioned it earlier, but again, I'm not impressed with the commercial genetic studies that are out now. And I say that because I don't think they use the appropriate methodology to determine the genes that they're looking at. For example, I guess I shouldn't use any names of the companies. But
we can. They're not paying for this tonight. We're good. You can say whatever you like.
For example, the Polaris test, what
Sure.
they are measuring is the cell cycles, and the cell cycling genes are the last one of the biological pathways, which I didn't get into, but I can, and they're the most affected of all of the other genes. It's really a cascade of genetic factors, and the last genes that are affected are the cell cycling genes. So they really won't show you much more than the Gleason score will, or the PSA, essentially, because that's what the Gleason score will and the PSA will tell you is a proliferation of the cancer. We know that you have a high PSA, you probably have a large volume of cancer. And as far as the Gleason score, it tells you about the aggressiveness as well. But we want to know, before it reaches that stage, what is the potential of that happening? That's what genetics is supposed to do. It's supposed to tell you what's going to happen 5 years from now. For example, the patient you just talked about, who was on active surveillance for all these period of time, then all of a sudden his cancer began to progress. A good genetic study will tell you that before it happens. And the genetic studies are out there now are telling you what's happening in real time. They're not telling you what's going to happen 5 years from now. They may say that, but none of them that I have seen has actually shown where they can identify the mechanisms that show the progression of disease. And that's what we're getting into now, is not only the genes, but what's the mechanism that's happening here? What, for example, Gleason score 6, the cells are all adherent. For that, those cells cannot metastasize. They have to come apart. And in Gleason score 7, 4 plus 3, that 4 component are now mesenchymal cells that can now invade and go elsewhere. The genetic studies that should be able to tell you that, and what that involves is what we call epithelial mesenchymal transition, where the cancer cells go from adherent cells to loose cells that can now invade and spread elsewhere. So those genetic studies that are out there now cannot tell you that, because they don't participate in the mechanism that causes these events to occur. I know I'm kind of probably, that may be difficult to understand, but it's easier if I show you pictures, or I don't have pictures, but that's what has to happen. So I don't trust any of the commercial studies there, and I don't use them.
Well, actually, I like this. Let's kind of pretend it's just you and I talking between the two of us and nobody else is watching. It's just you and I.
Yeah.
Sorry, Joel, just a quick question. What do you think there's any game changers right now waiting that, not necessarily I want to buy their stock because that's not me, but are there any game changers in the genetic testing world that you think are on the cusp of greatness?
Gosh, Mike, I don't know what insider trading is, but I'm actually participating with a pharmaceutical company now. That might be insider trading. I don't want to get into that issue.
But what makes that test so awesome, do you think? Because it must be really worthwhile if you're actually involved in doing the studies with it.
It's what I've been talking about. It's these pro-inflammatory cytokines that, and I will tell you this, they're not only the drivers of prostate cancer, but they're drivers of colon cancer, lung cancer, breast cancer, pancreatic cancer, COVID virus, HIV, and HPV. And what these genes are, a part of the immune system. The immune system is very complex. And we throw it out there as it's like one entity, which it is not. There are anti-inflammatory cytokines. These are the ones that protect you under all diseases. These pro-inflammatory cytokines protect you against infections, such as bacterial, fungal infections, or parasitic infections. But for chronic disease, they become components of driving the disease. I was asked to come to the NIH to evaluate their research. This was years ago, not that many years ago, and I didn't know why they wanted me to come and talk about their research, which was in lung cancer. What they found were the very same genes I found in prostate cancer that causes progression of lung cancer. Those are the pro-inflammatory cytokines. And they actually initiate multiple biological pathways, as I mentioned earlier: metastasis, stem cell production, proliferation, heterogeneity. It causes the first step of the epithelial mesenchymal transition, changes those adherent cells to individual cells, allow them to invade and spread. And
well, we're gonna stay tuned to your research because we know that we're gonna learn something in the next year or two. So thank you.
Okay.